Hello everyone. Today we will talk about sore nipples while breastfeeding, causes and remedies. Sore nipples are a fact of life for breastfeeding moms. Yes, we all know that breastfeeding is not supposed to hurt, and it's true. If baby is latched on well, it should not hurt, but at some stage you are likely to be troubled by nipple pain. Even lactation consultants, when they start breastfeeding, their own babies get sore nipples sometimes. So it's important to know how to identify the problem and what to do about it. Here we will talk about the most common reasons why you may struggle with sore nipples and what can be done in each situation. Pain is almost always a sign that something is not working as well as it should. And yet, there can be some pain even when everything is fine. Confused? I don't blame you. Let me start by clarifying what is normal and what is not. When you start breastfeeding for the first time, your nipple is being pulled and squished in ways it never was before. Did you know that with every suck baby gives, your nipple is being stretched to 2 to 3 times its resting length? If you consider how many sucks a baby gives in a feed and how many times a day you breastfeed, it quickly becomes clear that your nipples are taking quite a beating. This unaccustomed stretching can cause your nipples to feel sore in the beginning of the feed when baby starts to suck, but the pain then goes away as the baby settles into a comfortable suckling rhythm. It's very similar to having sore muscles after a workout. When you start your next workout, it's agony, but as soon as the muscles warm up, the pain is gone. In the same way, your nipple should feel more comfortable as the feed progresses. A simple rule of thumb I use is as soon as baby is latched on and starts suckling, slowly count to 20, then ask yourself how it feels. If the pain is gone, you are good to go. Carry on feeding. If it still hurts, baby is probably not latched on well. In that case, you will need to take baby off the breast and start again. Pretty much any nipple pain other than what we have described above is not normal, including pain that lasts for the entire feed, pain in between feeds when baby is not suckling, pain that is so severe that you want to scream or cry, cracked, broken, or bleeding nipples. Take note, broken skin is never normal. Nipples that suddenly become sore after they've been fine for some time. If any of this happen to you, please try to figure out what's going on, and if you can't manage by yourself, get help. Latch. Most of the time, sore nipples are caused by a bad latch. If baby is not latched deeply, in other words, if baby doesn't take a large part of the breast into his mouth, the nipple will become sore. If your baby isn't latching deeply, nipple pain is inevitable. So, the first thing to do is to make sure your baby is really latched on well. Look at your nipple as it comes out of your baby's mouth after breastfeeding. If it's squashed to a point like a new lipstick, your baby probably isn't latching deeply enough. Unfortunately, in the beginning, it is usually necessary to really concentrate on latching baby well. It's so easy for that tiny mouth to latch onto the nipple only, instead of the whole breast, and it only takes one feed with a bad latch to cause a cracked nipple. There's some good news though. It gets much easier with time. As baby's mouth gets bigger, it's easier to get a deep latch, and eventually you will be able to do it without even trying. This is especially true if you have very large nipples. They can make it quite difficult, if not impossible, for baby to latch deeply. But the problem is guaranteed to resolve itself over time. Tongue tie. A tongue tie occurs when the little membrane under the tongue is too short, too thick, or too far forward, which stops the tongue from moving freely. Because the tongue does most of the work in breastfeeding, a baby with a tongue tie can find it very difficult to breastfeed effectively. These babies tend to move their tongue in a different way to try and hang on to the breast, which can cause severe nipple pain for mom. Many moms have described it as a feeling like sandpaper rubbing against the nipple. When a baby has a tongue tie, he cannot lift his tongue or stick it out. Sometimes the tip of the tongue forms a notch or heart shape when the tongue is lifted or stuck out. Sometimes you can even see the thick white membranes anchoring baby's tongue to the floor of the mouth. When baby is suckling, the tongue tends to pull back into the mouth and then push the nipple out. You may also hear clicking or smacking sound as the tongue slips off the nipple. If you see any of these things and you are worried about a possible tongue tie, it is best to see a medical professional who can assess it accurately. If your breasts are engorged, your nipples can get damaged from two sides, partly because of all the swelling and stretching that the engorgement causes, and partly because it is very difficult for a baby to latch deeply on an engorged breast. In my experience, engorgement is one of the biggest causes of sore nipples in the early days. Did you know that you can get thrush on your nipple? Yes, the same yeast infection that causes vaginal thrush and thrush in baby's mouth can also affect the nipple. Thrush is especially common when you or baby have had antibiotics recently. If you have thrush on the nipple, you may notice that the nipple is a lot bigger than the surrounding skin. You don't get white spots on the nipple like you would see in baby's mouth. Often you will also see signs of thrush in baby, white spots in the mouth that you can't wipe away, or a nappy rash that is red and bumpy. You yourself may also be suffering from vaginal thrush. Seek medical advice. This is a guide on nipple pain. Thank you for watching. I hope you've learned about sore nipples. Kindly subscribe.